We all know that babies love to be held, and sometimes this interrupts us getting done tasks like cooking, cleaning, maneuvering around the house. It's very common to prefer holding your baby to one side of your hip, which causes your hip to jut out to the side like this. After an extended period of doing this day and over, it causes a shift within the low back. When you stand with your hips out to one side, your spinal alignment in your lumbar spine ends up moving slightly to one side. And eventually, if you're holding your position over a long period of time, you're going to end up, even when you're not holding your baby, starting to tend to feel like you're swaying towards that direction. A tip that I would suggest is making sure that as you're holding your baby, you are alternating sides, and even better if you have a carrier that you can hold your baby at midline. Looking at your spinal mobility. One test we do for patients is having them cross their arms over, try to keep their shoulders steady and not moving, and look at how far they can move their hips to one direction and then to another, like you're doing a hula dance. And when you're moving in these directions, they should be equal and pain-free. After holding your baby, if you notice you try to move through this direction and one side starts to feel tight and painful, you're probably doing your back some disservice and creating a problem in the future. Make sure you're alternating sides, working on your spinal mobility to help avoid future problems in your back.